So to begin, how would you define the word trauma?
So in orthopedics and hospital terms, we might define trauma as physical trauma, like I've been, hit by something, or I've fallen over, or I've got a blunt mechanical trauma. But trauma, in the sense that we're using it here, is really anything which overwhelms our nervous system's ability to cope. It may be singular traumatic events, or it may be multiple smaller events.
Could you explain the connection between our nervous system and trauma?
Sure. So the nervous system, we can divide the nervous system into the central nervous system, which is the brain and spinal cord, the peripheral nerves going down our limbs, and that has motor and sensory, but also we have the autonomic nervous system, and that, as the name implies, governs involuntary actions. Our pupils dilate, our hairs on our arms stand up, our heart rate goes up, goes down. In order to control that, we have to have a plus and a minus. We have something which is a stimulatory and some which is sedatory, and they create different effects. The so-called sympathetic and parasympathetic. So if we have a shock event or an emotional event, then this will create perhaps a physiological response in our body. We might need to run, or we might need to fight, or we might need to try to co-regulate and bring calm to a situation. All of this is under the control of our autonomic nervous system. And so if our nervous system is overwhelmed, then this is what we would call trauma. So if something happens that is too big to process, and we have to use some adaptive strategy in the moment, this would be trauma. And that adaptive strategy we use in the moment then sadly later becomes maladaptive.
So could you give some examples of the types of treatment you would use within trauma therapy?
Right, yeah, I'm not purist at all in the way that I do anything, really, and certainly not in the field of trauma. My journey into trauma work began through craniosacral work and working with people, very light touch in the body, and finding that sometimes emotions would come up, or memories, or there'd be big shifts in the body and sensation changes. So, and sometimes I will still use craniosacral type techniques to try to bring the person back into the body and to try to release stuck energy, if you will, from the body. So those old strategies I still employ sometimes. I might use movement therapies. Obviously there's usually a big focus on training the nervous system and training the parasympathetic nervous system so that it has a better ability to cope when we lean back into the areas that are where the trauma exists, or go through conversations which might be upsetting and distressing, because if we're not careful we can re-traumatize the patient. So it's important that we give some new skills to this parasympathetic to stay regulated while we're then able to maybe work through what was traumatic, so this time allowing the body to process things. Somatic psychotherapy and sensory motor psychotherapy, I very much believe that it's necessary to have a top-down and a bottom-up approach. I think some people focus almost entirely in the somatic domain in the body, some exclusively in the more psychological side, and I tend to think that we need to marry both up. So often I will use inner child work, reparenting work, different types of more psychotherapeutic models to try to help reprocess things at a cognitive level as well.
What would you say the main goal of trauma therapy is? Would you say it's regulating the nervous system and attempting to help people not get as overwhelmed in their day-to-day life? What would you say the main goal is?
The main goal, gosh, is really just to help people live their lives without the disabling effects of the trauma. Now, of course, that trauma could be that they're suffering PTSD-like symptoms, they're getting tremors, they're getting shutdowns in a PTSD classic sense. It could be that they've got Tourette's, it could be that they've got more autoimmune problems that they hadn't really equated to trauma. But it might be that we're dealing with their pain, physical pain, and their IBS, or some Crohn's disease, or autoimmune based diseases. So it's about trying to give people back their quality of life.